Dengue, diarrhea, respiratory infections. Diseases like this and many more is a big issue for health. And this problem is a big deal that is occurring worldwide. But in this era, in this digital-driven society, we can change it for the better. These diseases are prone to produce in dense areas with challenging sanitary conditions. Challenges like climate change, weather, and improper waste management affect citizens and children in dense and slum areas with health issues.
The prevalent percentage of children suffering from stunting and malnutrition is 16.8%, and that is only in Jakarta.
In this instance, diseases are widely produced from environments, making environmental management a key to support the creation of disease-free environments.
But unfortunately, in this digital era, teenagers are also facing a much more difficult and complex health and social issues compared to the previous and older generation, such as mental health, reproduction health, nutrition, and the misapplication of social media that affects the awareness of sanitary and healthy environments. And for that reason, teenage empowerment through health and sanitary education plays a big role in investing a strategic, healthy, and productive future generations that are ready to face what's coming in the future. This is where our program comes in hand, introducing to you Young Health and Green Action, presented to you by Nara Kreatif. I'm Omar.
And I am Zamar.
And both of us are part of PKBM Nara Kreatif,
located in Jakarta, Indonesia. We will be explaining about our initiative program about health and sustainability actions. Young Health and Green Action, YHGA for short, is a program led by Nara Kreatif students to improve the quality of the health of the citizens and environmental sanitation through education, community action, and digital technologies. This program is implemented in 20 of Nara Kreatif's learning center around Jakarta and its surrounding regions. This program also contributes directly in accomplishing sustainable development goals, especially in the health, education, and environment field.
Teenagers aren't just a beneficiary of change, but also an agent of change that has
the capability to influence their friends, family, and their surrounding environments.
And for that reason, the main goal of the YHGA program is to shape the younger generations into an agent of change
that are capable to push clean and healthy life habits, fix sanitary environment conditions, and improve the public participation in creating a healthy and sustainable environment. We'll cover at least 40 health leaders and the minimum of 2,000 community members that are exposed to this program.
Over the course that this program is being implemented, YHGA focuses on 5 main pillars. The first one being student health leadership that focuses on recruitment and training of student leaders. The second pillar focuses on building a healthy school and community campaign that supports education to teenagers and the surrounding citizens in Nara Kreatif's learning centers. For the third pillar, we will be focusing on building a digital community mapping in each learning center to help organize reports and updates for future programs and determine policies.
We are now at the fourth pillar that is performing clean and healthy actions.
To develop habits and make impacts that have visible results, the implementation of this pillar involves making green corners with family medical plans that serve as learning media, building accessible handwash sinks in every learning center, and arranging clean and healthy initiative competition across learning centers.
And the last is pillar 5. Focusing on digital health campaign
through social medias to help push our campaign to wider audience, such as digital posters, educational videos, and podcasts discussing around health.
As for our implementation plan, we will have 3 phases over the course of 2 years. In the first year, focusing on development, probation, and full implementation to all of Nara Kreatif's learning center. And in the second year, we will expand our community, organize events and competitions to furthermore strengthen the program's sustainability. YHGA will not only make a change, but also gives teenagers the opportunity to make a change. Through digital development, students can practice sanitary conditional mapping, public health surveys, environmental problem reports, and organize healthy digital campaigns.
This approach allows a data-driven behavior change and is replicable in various regions to also help the local government in serving the latest data and updates as a baseline for future programs. The Young Health and Green Action program allows us to have the capability to make change for the better.
And we can be a part of it.